what do you do for diabetes and COVID? There is an increased risk for complications and mortality once you get it. Now, it's very important that you get yourself vaccinated, very important. You wear a mask, you have social distancing, and you do all the things that you're supposed to so that you don't get it. You always want to, of course, have a healthy diet. You want to check your sugars, you want to take your medications. It's also important to have a stock of medications at home for any period of time, especially insulins, because you never know. You've been through a pandemic and you've seen how things disappear off the shelves and how things close down and you may not get your supplies. And, so you want to have something at home as some kind of extended period of time. Nowadays, you can talk to your physicians through telemedicine. They're willing to help you over the computer, which never existed before. They're doing a lot of video visits, phone call visits, and so forth. You may not have to come in. And with the continuous glucose monitoring systems, the interesting part is that you can actually transmit your blood sugar data via computer to your doctor. So I have a lot of patients that send their blood sugar data to me, and I'm able to see it and I'm able to discuss it with them, which I think is remarkable for the times that we're in. So it's very important to continue your medications, all your medications, unless you're very severely ill. There are a couple of medications that you want to really be, I'm just going to put in some names. I don't know if any of you know them, but the SGLT2 inhibitors, which are like Jardiance, Farxiga, Invokana, they cause dehydration a lot of times. And sometimes when you're really sick and you're not drinking enough water and you're ill, then those are the kind of medications that can get you into trouble because you're not drinking enough and you're dehydrated. They can put you into kidney failure and so forth. But if you don't have COVID, they're good medications and you should continue to take them. And the other ones that are used sorry, this was actually supposed to be an H at the bottom, ACE inhibitors and ARBs, which they should be continued. They're more for blood pressure and diabetes. They protect your kidneys. But if you do develop COVID and you're very, very sick, these are another set of medications that can cause kidney failure. So a lot of COVID patients who are very, very ill, sometimes insulin is your best option. Once you go on insulin, it doesn't mean that once you get better, you can't go off of it. You can always come off of it. Insulin is something where, you just sometimes you need something to treat something, and that's what it is. Okay, it's not like a death sentence or I'm going to be on this thing forever, or now that I have it, I'm going, I'm really bad, or any of those kind of thoughts.